So, should you be worried about getting nodules from Sculptra? I had to address this concern because this seems to be people's biggest hesitation when they think about getting Sculptra. But just to let you know, it can happen with filler too.
So what's a nodule? It's a small lump under the surface of the skin that's greater than 5 millimeters. This nodule is not from Sculptra. I just wanted to show you what a visible nodule could look like. Most of the time, nodules from Sculptra are not visible like this one.
So you can have visible or non-visible nodules. And one good thing is, most of the time when people develop nodules from Sculptra, they're not visible, so you can't see them.
So you wouldn't know they were there unless you press down on your skin, and you usually have to press firmly.
When I first started using Sculptra over 10 years ago, it was shortly after it got FDA approval for cosmetic use. Maybe 2 years after I started using it. The other PA and I were experimenting with it and testing it out to see how it worked, because I was on the hunt to find something that lasted longer than filler. Filler just didn't last long on me because I worked out a lot. So we were a little less familiar with it, and even to this day, Sculptra is not as widely used as filler is, which is why I call it the best kept secret. So this was maybe back in 2011. After the first 2 treatments, I felt small papules to my temples. And I say papules because they were smaller than nodules. They were smaller than 5 millimeters, I believe. And I wasn't upset because I knew this could happen, and they weren't visible. You could only feel them when you pressed very firmly down on my temples. With further treatments, maybe 1 or 2 more vials, they completely resolved. And to this day, I treat my temples with Sculptra. I love treating temples with Sculptra, and I don't feel anything. No nodules, no papules, nothing. I think the reason I may have developed papules is because I started using Sculptra earlier on. We were less familiar with it. We were less familiar with the injection technique. And I don't know how long I prepped my vial, which we'll talk about later. Either way, I do Sculptra to my temples and other areas of my face to this day. No more papules, nothing. It feels like my regular skin because it is. So why would this happen?
Sculptra is made of PLLA, short for poly-L-lactic acid. PLLA is a collagen stimulator that works within your skin to help restore collagen. The PLLA are microparticles that are injected into your skin tissue, and they're suspended in water. So you want them to be distributed evenly when they're injected, which is why you'll commonly see us swirling the vial. Like if I were cooking or baking a cake, when you add things to it, you want it to be distributed evenly.
And the whole reason we want the particles to be distributed evenly is because we think nodule formation happens by one of these 3 proposed methods.
Theory number 1, excess deposition, like if too much PLLA got injected into one area. Theory number 2, local clustering of many PLLA particles provoked by an unequal distribution due to lack of massage to the injected areas. Theory number 3, incorrect depth of injection and tracking of the material during needle withdrawal. This is the whole basis for massaging you after your treatment, and we ask that you also massage the treated areas after your treatment. We want everything to be spread evenly, and this is a way to reduce the risk of getting nodules. It's ideal to massage 5 minutes, 5 times a day for the next 5 days. We call this the rule of 5s. Back in the day when Sculptra was being used for HIV facial wasting, lower volumes of water were used, a 5 milliliter reconstitution.
But people were developing more nodules, and since then, the dilution has been increased to 5 millimeters or more.
Most of the time, people use 8 milliliters or more of water in order for it to become a thinner suspension.
And the incidence of nodules have decreased significantly. So the higher rates of dilution have lower incidence of nodule formation.
Galderma, the makers of Sculptra, recently got approval for immediate use reconstitution. So right now there's no standing time at how long Sculptra should be prepped or hydrated with water, meaning you could just prep or reconstitute a vial and immediately treat someone. But I still like my Sculptra to sit with water for a minimum of 72 hours and preferably at least a week before I treat someone with it because I haven't had issues.
There was a study done on nodule formation that was conducted last year in 2021. It was a 2-year study. There were 80 people treated total in the study. Some received Sculptra at the lower dilution of 5 milliliters, and some received Sculptra at the higher dilution of 8 milliliters. One of the study subjects developed a nodule, and that was from the lower dilution of 5 milliliters. None of the study subjects who received the 8 milliliters dilution developed a nodule. So it definitely seems that nodule formation is more possible with a higher concentration, lower dilution rates of Sculptra. Most papules or nodules resolve spontaneously on their own with no treatment. But what happens if you get a nodule? How can we treat them? Most of the time we treat nodules or papules, we try to inject them with something to try to break them down.
Treatment options for nodules include injecting them with saline, intralesional steroids, 5-fluorouracil, sometimes people give systemic steroids, antibiotics, allopurinol, and lastly, surgical removal.
The bottom line is Sculptra is usually well tolerated and reported patient satisfaction rates are high with relatively low complication rates. So, should you be worried about getting a papule or nodule from Sculptra? First, let me say that everything in life comes with risks. No matter what cosmetic treatment you have done, it's going to come with risks. It's like saying don't ever drive a car because you can get in an accident. It doesn't stop any of us from enjoying the benefits of driving, even though you can get in a fatal accident. So for most of us, the benefits of driving outweigh the risks, which is why most people drive, or if you don't drive, you take some form of transportation. So you have to weigh the benefits versus the risks with everything in life. So to answer your question, should you be worried? No, I don't think you should. But what you should do is make sure you find an experienced provider who is well versed in Sculptra and has treated many patients. And if you want to learn more about the wonderful benefits of Sculptra, check these videos out.